Pictures.
Yep. Good evening, viewers, and welcome to this episode of our new series, Being Well and Well-Being, which is brought to you jointly by Proho.in and Nuvah LLP. And today we have a very illustrious panel with us today. So let me just introduce the three gentlemen here with me. First, we have Daljit Singh, who's a board advisor, mentor, and executive coach. And in his long and illustrious career, he has previously served as a president at Fortis Healthcare. He was also an executive HR director at ICI India. With him, we have Paul Abraham, president at the Hinduja Foundation. He's a startup mentor, investor. He's the CEO, founder of Sarmaya Arts Foundation, and also a board member at IndusInd Bank, where he was formerly, up until last year, its COO. And of course, Paul is no stranger to this forum or to Prohor because we had an interview with him about 8 or 9 months back when we were still very much sort of deep in lockdown mode. And last but not the least, we have our guest from the US, Alan Work, who is the president of Work and Partners LLC, an executive firm that's based in the US and that's been in the space for 3.5+ decades. So, gentlemen, a very warm welcome to all of you.
Thanks for having me.
Yeah, all right. Daljit, why don't we start with you? And let's talk about healthcare, right? Now, as we know, healthcare, right from the very point that this pandemic erupted on the global stage, everyone related to the healthcare sector have been frontline workers. And from the perspective of the common man, right, we often tend to think of these frontline workers or COVID warriors, right, as being somehow fireproof, as if they're made of refined steel or something, and that I think belies to a very large extent the huge amount of tension, pressure, the emotional, physical, psychological trauma that we're going through, and many of them are still going through. So it'll be good to get the view of the insider view of the healthcare workers. What's it been like for them this entire pandemic period?
So Avik, thank you very much. Pleasure to be on this panel, and let me share my views on the points that you've actually raised. First of all, I think this is perhaps the first time, at least in modern memory, that the public at large is getting a first-hand view of healthcare workers, in their true element. And why do I say this? The healthcare workers, doctors, nurses, and other people who operate hospitals, this is something that they have dealt with on a day-to-day basis. This is what their training is all about. It's almost like, we notice our army and our soldiers only once there's a war. So they stand off at the borders and all, and there's shooting, and some people lose their lives, and they fight bravely, and the whole nation certainly goes gaga. Unfortunately, the healthcare people, the healthcare workers, have not necessarily been accorded that level of primacy or recognition. So these are people who actually who have been trained to manage sickness, disease, infections day in and day out. This is their training. This is their daily work. They spend most of the time in an environment which is rife with nosocomial infections. Nosocomial is hospital related. So hospital is full of bugs, viruses, and they live in that environment. They treat hundreds of patients on a daily basis. Hundreds of patients are living in the hospital, and they manage their lives in such surroundings, in spite of the various infections that are prevalent in hospitals. So one of the mottos in hospitals is that we don't want to keep patients longer than they need to stay. The reason being that we don't want a patient to acquire these nosocomial infections. So doctors and nurses and healthcare workers are used to dealing with this on a day-to-day basis. This is nothing very unusual. Okay, Indian medical professionals specifically um, are mentally attuned to dealing with infectious diseases. Their ability to get rattled, I believe, is extremely low because India is a hub for infectious diseases. We all are subject to flu several times during the course of the year. And these are the same people who've dealt with SARS, bird flu, et cetera, over the years. And therefore, when COVID came in, it was something new on the horizon, but it was different. It was an unknown, and it sprang upon us without much warning. The first month, I believe, was pretty chaotic. Just around the time when the lockdown was being announced, where hospitals were figuring out new protocols, creating segregated spaces for COVID patients, non-COVID patients, training, informing staff, norms for PPEs, for social distancing, hand washing, disinfecting the workplace frequently, handling in patients that they came in were established and implemented, and people had to be trained on this new way of working, and I believe, about almost 6 weeks, between up to 6 weeks within the lockdown. And I remember talking to a couple of very senior doctors in some of the leading hospitals in NCR, and and the doctors very nonchalantly sort of said, "Oh, I see my patients. We do a lot of video calls, but many patients do come across, and I maintain. I wear PPEs. The patients wear PPEs, and they sit across the table, but you've got a screen in front." So the point I'm trying to highlight is that whilst COVID is different, was different, it was an unknown entity, but from the doctor's perspective or the nurse's perspective, it was almost work as usual, but with a little bit more care in the entire system. Okay. Where did the tension really come from? I believe that the issues really arose because these are the same people who, when they went home, they consciously distanced themselves from their family members. So I know of hospital administrators, doctors who would go in, take a bath, would not necessarily meet their wife or children, etc., or their spouses, and they would live in a room which was a separate room, and they did this for close to 8 to 12 weeks that I'm aware of. So, and with the consciousness that we should not be carrying any infections that may infect our family members. For nurses, it was somewhat different because most of the nurses were living away from their families.
Families.
So, from their families, okay. So, however, there was a period of extreme stress. Why? Because hospitals were full up, attendants wanted information. By the hour, patients demanded better attention. Unfortunately, hospitals were strapped for people. The nurses and doctors had to do a lot more than they normally did. They had to adhere to new protocols of reporting, of wearing PPEs, etc. There was a huge amount of uncertainty in the air, and it was many of these external factors that actually caused stress. And this bulk of the stress, in my opinion, was created by a lot of, call it, media news, the WhatsApp news that went around social media, etc., and by the expectations of patients and attendants rather than by the disease itself. The good part of the story is that many of the private hospitals, in fact, most of the private hospitals that I spoke to, they reported zero or close to zero cases of the spread of COVID amongst their staff. And this simply tells you a story that the healthcare workers are attuned to following certain protocols whilst at work because this is their daily job. I think the positive spin of the pandemic, in my opinion, a bit tongue-in-cheek, was the apparent turnaround in public sentiment towards private healthcare. For the first time in 2 decades that I've been in the healthcare sector, I heard positive sentiments being expressed by the general public, stakeholders, government, for the stellar work being carried out by healthcare workers, and they were renamed as frontline warriors. I
Yes.
believe that this is a recognition that they not only deserved well before the onset of COVID, but better late than never. My only hope is that this sentiment is not temporary. And the other part, which I believe is a positive spin of all this, is that I think there is recognition in hospitals generally and amongst public sector, private sector hospitals, that reinforcement of hygiene control protocols, disinfection, frequent washing of hands, etc., um, needs to be religiously followed. And I think it's heightened that to a very to a new level that hopefully will make healthcare in the future far more positive.
Great.
Thank you.
That's really useful insight from you, Daljit. And back for more questions. Let's move the lens. Let's shift the lens from the healthcare sector to banking and financial services. Together with healthcare, right, and together with law and order, this was part of the essential services all through the pandemic period and the deepest times of the lockdown, right, Paul? And we
Yeah.
had multiple discussions last year, and you said that notwithstanding all the protocols and the SOPs, there were instances where people in the front office, in fact, at HO at IndusInd, would get infected. And the last time we spoke, you said, it's nobody is immune to this, right? Like the CHRO was contacted with COVID and had to be hospitalized, right? So now that you reflect, I mean, looking back at those times, right, at those worst of times where you still had to keep the banks open because you had to serve the customers, and there was a huge amount of stress and pressure, and people were getting infected. How did you, as a stakeholder, cope with those times?
It's an amazing situation to be in. You have often in those early days, I remember April, May, June, there were occasions when there were no customers during the course of the day because people were so panic stricken. And yet, there were times when people were completely stranded because they were in need of money. Some of them were absolutely unaware of how to operate in the digital world and navigate that. So the physical world became their only way, and soon they decided that they had to learn to adapt. And those early days when we used to have to bring all our staff to work, the whole environment was of uncertainty. Uh, there was uncertainty when you went to work. There was uncertainty when you stayed at home, and some of whom were allowed to work from home had their own peculiar situations. So, for example, some of the older staff did not possess a laptop at home.
Okay.
So they were connecting with smartphones. Some of the people lived in rather modest circumstances, and they would not have the privacy of space. So we would have a conference call, and you would find people walking up and down. There was general stress on that account. Then
Right.
the whole gender issue that came up. We would have men allowed very naturally to stay connected with work, but women expected to double task and manage the kitchen and the children and the
And
children
work.
line
Yes.
work and all of that and work. So we found that there were a lot of stressful outcomes as a consequence, both with staff and with clients. But I must say that once this initial, hump of uncertainty passed, it kind of became a lot more manageable. In fact, I think one of the best outcomes of this whole COVID has been the digital adoption all around. You know, in some senses, it does undermine the brick and mortar structure within the banks. But having said that, today I know a lot of people who were aghast at the thought of ever operating Google Pay or a Paytm or any kind of digital payment are now absolutely comfortable with that. Every kind of vendor who comes home is absolutely comfortable with that and gives you multiple options. Yeah, but you're right. The stress was significant, and the stress came about on account of a variety of reasons, and those needed to be addressed and managed. And for HR departments didn't necessarily have the answer to every one of them. I mean, what happened at home was completely somebody else's business till COVID hit us. And then HR departments had to figure that what happened at work as well as what happened at home often was equally important.
Right.
And some form of addressal, And I've written about this in a couple of articles. Giving people subsidy, some kind of subsidy to get even things like bandwidth availability at home, the last mile. Because if they have to stay connected and be on call, not all of them had that kind of connectivity available. And it was, an expensive outlay. So we needed to kind of think about those kind of issues also. I think HR departments, certainly within the banks, initially were coping with facilitating arrival, departure, safety, those kind of concerns. Quickly on to facilitating infrastructure related, gender related, those kind of issues. Now, of course, it's kind of, steadied out. We are back almost to normal. Business as usual. Of course, I think the one big significant change that has happened is physical footfalls are a little less compared to the heydays.
Pre-COVID times.
Yeah, pre-COVID. But transactional volumes are back to where they were. The only difference being a larger chunk is happening digitally now.
Right. Yeah. Thanks for that, Paul. Alan, we'll come to you. I mean, it's ironic, and of course, everybody's talked about it through last year, that the most advanced nation in terms of public health care, in terms of facilities, in terms of medical advancements, was and continues to be the hardest hit by the global pandemic in terms of fresh cases, in terms of numbers, in terms of fatalities. Now, as an individual who runs a business, how was the experience for you, the entire pandemic? How did it affect your well-being, your psyche?
Well, first, thank you for having me. Nice to meet everybody. I think that the most important thing that it gave me from a well-being standpoint was perspective. I live in a nice house in Westchester County, New York. I came and go as I pleased. My daily life has been disrupted at significant levels. But when I listen to Daljit and Paul speak of the experiences of the frontline workers, the people that are out there every day dealing with this, I'm a P in this whole process. So it certainly has had a dramatic effect on me from a business perspective and from a personal perspective. But again, the stories of what goes on, outside my little world that don't affect me are the ones that, that affect me the most at some level. It's changed my business model significantly. I traveled a lot. My face-to-face meetings changed. But it's also opened up doors. In the past, the people I deal with were on planes, trains, and automobiles. And, I used to get them in between meetings, at night at a hotel, et cetera. And now pretty much everybody's available for Zooms or WebExes or Google Meets, whatever. Well-being standpoint, I think I sleep less. I think it's had that effect on me. I think about things more. Things keep me up at night more. I haven't had COVID. I did recently get my first COVID vaccine. But we've had a number of friends that have had COVID, and some pretty significantly. So that's been some challenges. I find that the one very positive to my well-being, my daughter gave up her apartment in the city and she lived at home with us for 8 months. And it was the most wonderful thing to have my 27-year-old daughter home with us for 8 months, every day. So
Great.
that probably had the most positive effect on my well-being and negated any of the negative parts of the well-being. My wife, both of us have offices in the house, but we also work elsewhere. And now she's 10 feet away, and we're both loud Jewish kids from Brooklyn, and our voices compete pretty heavily. Hers is a little bit better than mine since she did sing over the years. She wasn't a professional, but she was a pretty good singer. It's been interesting to see the effect on friends and family, and the different perspectives that people have on it. In the past, you didn't start every single conversation talking about COVID, and for the most part, a lot of the communication is driven by COVID. Whether it's stay safe, I hope you're safe. Tell me what's going on with you. What do you think about everything that's going on? Certainly an icebreaker, but not the icebreaker I want. I have friends that are in the PPE space, and they're all doing very well. And but they also can't wait not to be in the PPE space. Although I don't think that's going to happen so quickly.
Right.
I think overall, I've dealt with things pretty well. I'm somewhat of an existentialist, so I kind of able to, make the flow and go with the flow kind of thing. Things tend not to get at me too much. I'm not sure if that's good or bad. Some people say it's bad. Some people say it's good. I hope that answered your question.
Yeah, it does. It does. And we also get a feel of your sense of composure and poise through which you've been able to tide over hopefully what has been the worst times.
That's medication. That's medication.
Right. All right. Daljit, back to you. And I'm going to take a cue from what Paul said earlier. We talked about the HR predicament and HR searching for and initially grappling for those answers, right? Now, if we take the HR function as a whole, for the longest time, their grouse has been, we are not empowered. We are not asked to lead from the front. We don't have the resources that we require. We don't have the budget. We don't, right? Now, this pandemic has turned the spotlight on HR, right? Not only have they become more empowered, not only do they have the budget, but they're asked to deliver, to lead from the front. And suddenly they are asked to give all the answers. So when that situation happened, and of course, it's by no means gone, was HR prepared, you think, behaviorally, psychologically, to really lead from the front?
Okay, let me try and give you the answer. I don't think anybody was really prepared for this pandemic and the implications that it had. People initially struggled with the entire concept that, we can't go to office, starting whenever it was Monday evening, whenever our Prime Minister announced, the lockdown. So what happens now? So I think it was not simply an HR issue, or it was a people issue, certainly, but it was an issue that grappled the CEOs and every single, I think, manager within the organization, every single leader of every organization. And then, naturally, because people put their minds to it, solutions emerged. And I think during this pandemic, I don't think HR by itself has had a uniquely call it a different role. But they had to perform their role in very different circumstances, because the role, whether it was sales, whether it's business development, whether it's P&L, whether it's accounting, whether it's audit services, you name it, everything actually changed. In hospital settings, for example, the consultations were largely happening online. A lot of elective surgical work was postponed indefinitely. So people were beginning to grapple with the unknown in several ways. And I think one of there were several decisions that were actually forced, I would say, on the system because of necessity, and because we picked up these ideas and practices from each other. One was certainly work from home, and work from home has now actually transitioned to work from anywhere. So people not only started working from home, but many people went back to their villages, hometowns. People like me are in Goa. Many other people are in different parts of the country, and they are finding that they're able to work. So that was a great thing that happened, and certainly HR facilitation happened more by necessity rather than by planning, I would say. Okay. Then there was the deployment and reliance on technology that had to happen. So some of us who may have been hesitant to use technology, we had no other option but to figure out these Paytms and Google Pays and Zooms and every other platform to talk on. And we managed pretty well without the IT help desk, frankly. In many ways, IT help desk helped us, on the telephone, but it happened. Then managing confidentiality, confidential information, all or everything that was a bogey about working from home had to be done from home, and solutions emerged. I think that was fantastic, and everybody managed productively. And exactly the point that Alan made, that suddenly you were working from home, and there were a lot of positives about working from home, just as there were probably certain challenges that you face in homes that are not necessarily equipped for homework. And people had to get used to no offices, no commuting, no travel to meet customers, no entertainment dinners, board meetings that were for which people had to travel from abroad to come and attend your board meetings just for one day. People were spending 4 days in the aircrafts and airplanes. Suddenly, board meetings were permitted, from home and from anywhere. And I think those are fantastic things that actually happened. But I think what's now happened is that there are newer challenges that have now emerged, from an HR perspective, from a people perspective. I think the people dimension in every business has now very clearly emerged as the top priority for organizations, because without people, you don't have any business. I think that realization has dawned on people. And the newer challenges is about what happens to organizational culture, how do we define culture, what happens to bonding between people, impact of long absence from physical meetings, psychological well-being of people, loneliness, small homes not offering privacy, boundary between office time and home time. That gets blurred, especially in a country like India. What happens post-vaccination? Will things revert back to pre-COVID times, or will things be different? Now that work from home has been found to be viable, that employees don't cheat, they can be fully productive, etc., etc. What will the new corporate workplace look like? Time for reimagining. I believe this is something that corporate leaders have to think about, and particularly, in my opinion, it has to. HR has an opportunity to take the lead in this, and I don't think that the HR function per se is geared up, but nobody's ever geared up for the challenges that come up. And I think it's a great opportunity for them to take on a new mantle now. And in my opinion, the new HR function, will need to be an expert in organization human behavior. They need to understand, because today we are not talking about the basics of HR management or HR administration. It has to do with human behavior. You have to look at HR leaders have got to become like psychologists who can provide personalized guidance for individual welfare. And I think I'm talking personalized guidance in a more unique manner. We've always provided general solutions to people. Now people have to look at that, what is troubling me, what is troubling you, what is troubling somebody else, and can we tailor individual solutions for these people. They have to become designers of programs to keep employees in good mental, spiritual, physical health. They need to understand the role of social networks in employee well-being and productivity. They also need to get up to speed on the impact of global megatrends, whether it's pandemics, whether it's the role of technology, all this, that how are businesses going to be impacted? What will happen to jobs? What does it mean from a new learning point, perspective point of view, etc., etc. And they need to develop and strategize accordingly. I believe there's a whole new paradigm that that is sitting in front of us, but somebody needs to take that mantle up. And I believe the HR function ought to be the people who need to grab this and get on with the job.
Great,
I hope
Daljit.
that sort of addresses your issue.
Yes, absolutely. Bang on.
Thank you. Thank you.
And viewers, we are coming up to the halfway mark, so we're just going to take a quick 1-minute break and back after that. Welcome back. You're watching Being Well and Well-Being, and we are in conversation with Daljit Singh, Paul Abraham, and Alan Work. Paul, let me again take a cue from what Daljit was saying just prior to the break in terms of behavioral competencies, right? I think the back end of the year was replete. I mean, every single think tank, every single thought leader, every single convention, right, or body was talking about the behavioral competencies that are going to be fundamental to workplaces in 2021 and beyond, right? And we heard of creativity, innovation, agility, resilience, grit, emotional intelligence, empathy, just to call out a few out there, right? And if we talk about, let's say, emotional intelligence and empathy, let's take that as a starting point. If we're looking at it from the banking sector's perspective, um, during the lockdown and even beyond, right? And as we now get into that hybrid kind of a model, there are additional sort of stress points and pressure points. So, what are corporates doing? What is the banking sector doing? And what is, in particular, the HR department of banks doing to make sure that life and the experience of work is as smooth as it can possibly be for the employees?
Avik, one of the emerging challenges from a corporate perspective, and especially from an HR perspective, is the extent of engagement with your own colleagues that is now required. In the past, some of the interaction was kept to the formal, processes that were defined. You had appraisals, you had, review discussions, etc. But you rarely went into the realm of, the personal. Today, I think that has changed quite significantly. A lot of conversations have to be not just about performance. It's also about understanding what is preventing performance. So some of the facilitation that might just be required and which was not available and which was taken for granted in the past has to be revisited. The other thing is, of course, we've seen uh, a lot of cases of, stress arising out of just the whole uncertainty,
Yes.
how do I work? Am I seen to be effective? Because I don't even have the capacity to see basic body language of somebody sitting opposite and assessing and
Indeed.
judging.
Yes.
Uh, so, how am I doing is a big question. The second is that in the new format, am I a relevant contributor? The third is, the flip side of what Daljit said, which is that we found that now we can do all of this work remotely. And oftentimes we found that the so-called 8-hour workday is quite happily crunched into a 4-hour workday. And then, will I stay relevant? Will I stay secure? Is this a job that I may have 6 months from now when corporates reimagine their structures and their job allocations and things like that? So there were a lot of issues around insecurity. So, the need for HR to have that, capacity to hear, listen, engage, empathize, and rework things has never been higher. And I think that's one of the big things that, for example, in our group, we did find that mental health, which was, seen to be a distant problem, is now front and center in many ways. And recently, when we were talking about a potential new healthcare facility, because we have some land in North Mumbai, actually, we were contemplating a composite and integrated mental and well-being facility, because we suddenly see that there are all kinds of issues and challenges and situations which were never envisaged in the past. I mean, I alluded to a few of them earlier. The whole gender issue, the whole issue of how does a staff distribute their daily time, the ability to multitask, the ability to see everything in a linear format. I mean, in the old days, I could walk down the corridor to a colleague's room and have a quick chat and return to my
Yes.
room. Now I have to very formally structure a meeting because, you know, everyone has got Zoom schedules and webinars and this and that, all in commitments. And therefore, this whole thing of structure, ability to manage things on the fly, they all start to become juxtaposed against each other and become issues in of themselves. And that's where some of these challenges had to be managed. So I think HR is now grappling with that. So the feedback process, the assessment process, the well-being, the judging, the well-being, trying to address some of those situations, providing for access in terms of counselors, in
Right.
terms of people to have conversations with. All of these have become real, and HR currently, as we speak, is setting some of those in place. But yes, it's hastened so many things, you know. Even in the hospital where I sit on the board of the Hinduja Hospital, one of the things that we are happy about is some of the transformation that's taken place with respect to, say, telemedicine. You know? Today, it's not, but pre-COVID, it was still in the Indian context a very, very reluctant, regulatory framework. Today, it's much more open, much more accepting of the new world, and much more, accepting of new technologies like artificial intelligence, machine learning. To give you a quick example, we have an animal husbandry project as part of our CSR, where farmers can call up a call center and say that my cow is having a swelling on the face kind of thing, and we would have we had an army of vets. This is particularly in the state of Jharkhand, where we discovered they were all GPS enabled. So the moment the farmer called, he got a ticket, and within the vet had to call the farmer back, and within 6 to 12 hours had to physically attend to the problem. Then we found that if we put 4 vets in the call center, about 30% of the problems could be handled directly without
over the phone itself.
Yes. And now with artificial intelligence and machine learning, we are finding that another 20 to 30% are almost, you can actually script the questioning. So the call center employee takes the questions in a particular format and actually processes it with throwing out an advice at the other end. So without even human interface. So some of these changes are going to become amazing and relevant. And, we've had this conversation about Nuvah and the assessments and things like that.
Yes.
I think part of some of these things will get embedded into standard HR processes, in my opinion.
I'm just joining 2 sets of dots here, Paul. One relates to greater adherence and greater focus on mental, emotional, psychological well-being, which is for a large time sort of been relegated to a corner, or it was a taboo subject, no more. And that is where I think new age psychometric instruments will really come in handy. The second, interestingly, is something else that you mentioned, where the large number of questions to a call center, and that can be for animal husbandry, it can be for healthcare, it can be for banking, becomes part and parcel of the HR framework. So we can have chatbots, right? And that's where, Alan, I'm looking at you. Maybe this is a connection to be made right here. The work that you guys are doing at Concerto might play in very well, AI-driven conversational HR practices and outsourcing and advice and help could probably fit in very neatly to a number of things that Paul's talking about, right?
Well, Concerto's first client is the 800-pound gorilla from Seattle, Washington. They bought an HR self-service platform from Concerto, and right now, somewhere in the neighborhood of 98%, I believe, plus interactions between HR and an employee at, I don't want to say the name, in India, is handled by the Concerto chatbot. And it's everything and anything from, do I get vacation? How do I find out about vacation? What can I do to self-better myself and move up the food chain here? How do I, do my 401k? And that's through smartphone, smartwatch. They have kiosks, laptop, desktop, tablet, phone, et cetera, et cetera. All those interactions are handled by the Concerto bot, to the point where Amazon recently won an award, an IT Innovation Award, for our chatbot, but it was given to Alexa, because Alexa is the delivery vehicle of the information. But it's essentially was the most prestigious IT Innovation Award in India that they won, but obviously didn't give Concerto credit.
That was the Economic Times Award, right?
I believe so.
Yeah.
I believe so. And it's very interesting. So we and I say we, I work very closely with Concerto, like I'm working closely with you. They've developed a very significant HR self-service app that is up and running very significantly in India for the people out of Seattle, Washington, whose name begins with an A. We sold a different app to the people whose name begin with W out of Bentonville, Arkansas. We sold them 2 platforms. And separately, do you guys know who the Educational Testing Service is? They're the folks out of Princeton, New Jersey, that they implement the graduate record exams and the GMATs. Right now, all digital communication on Google Chat and Facebook Messenger is through the Concerto app. Where's the next test? When's the next test? How do I sign up for a test? I can pay for a test. And then at the end of the interaction, they'll offer to send a quiz every day to get you prepped for a test. So those kinds of interactions and that kind of data and that kind of information becomes very valuable. Agreed.
Absolutely. Daljit, we'll go to you again. There is much talk these days in terms of reimagining things, right? Reimagining prospects and opportunities, and also that of reinventing oneself. Now, I'm moving away from your work as a healthcare person, also as an HR thought leader, influencer, and senior director. And I'm going to focus, and I want you to share with us a lot more about your work as a mentor, as a CXO coach, an advisor of boards. If we're talking about behavioral competencies, what are the standout kind of competencies that you would see that people would need, people who you're coaching, people who you're mentoring, and what is your sort of methodology or framework to help people get there where they need to be?
Okay, that's an interesting question. I think Avik, let me just step back a bit.
Sure.
I want to I think draw attention to a very ancient text, almost 300 to 400 years BC, and you must be aware of that, Arth Shastra, written by Kautilya or Chanakya, who are the right. They say they were the same person, and during Chandragupta Maurya's time. And to my mind, there are certain aspects in this text which are very relevant to today, And this text is about statecraft. It talks about the role of leaders, the role of a king in society. At that time, king was was the guy he was the prime minister or the president of the country, and everybody was beholden to him. And I think if you look at the opening page, the aspect that they talk about is, it says the first and foremost, the role of the king is the welfare of his subjects. Now, to my mind, that's a very interesting insight, because today, all of a sudden, we've been talking about HR and importance of people these past 3 or 4 decades, but in some ways, it's also been, I would think, lip service, without really putting our hearts and souls and money where our mouth is, I believe today leadership is challenged by exactly this paradigm. The leadership thought and behavior today must necessarily be driven by the well-being of the employees first and last. that will be the determinant of success, I believe, in the marketplace. Okay, so to my mind, that's a very important aspect. The other bit is that employees can no longer be put in the, can no longer be cast from an old HR mindset point of view, where they're given the bare minimum and there are general things which are provided
Cogs
as,
in the wheel,
well, cogs on
assembly
the wheel,
line kind of
etc.
a paradigm,
Okay,
right?
yeah. Uh, I think it has to move to the personalized level, is the aspect that I spoke about earlier also. It's almost like in medical science today they're talking about personalized medicine, which is medicine targeted for a particular person, for the disease that he has, for the extent of the disease that he has, for the variant that he has, so that doses, molecules, etc., that actually go in are tailor made to that particular patient. I believe HR is moving in that, has to move in that direction if we are to evolve as a society that caters to the well-being of the human being and recognizing the centrality of the human being, to everything else that we do. Now, I think within that is the point that Paul made. He spoke about the mental aspects, the mental issues that are today coming up. I believe that it is the mind and the way a person thinks and his behaviors and habits that determine success in the at work. So earlier on, we looked purely at competence, that good communication, good skills, good personality. All that, I believe, is still necessary. But the aspects that we are looking forward today in a world that's changing very rapidly is, does a person have the ability to learn? Is he keen to learn? Is his attitude right? Does he have energy? Does he have passion? Is he resilient? Can he take failure in his stride and not be hassled? Because this is going to be the way of the world. And every time something unknown strikes us, we lie down dead. That's not going to be very helpful from an organization point of view or for the person point of view. Therefore, how do we make people who understand really the art of living to be able to make sensible choices in a world that's going to constantly throw things to them at them, which are unanticipated. So and I find this aspect. You asked me, what is my personal experience in coaching and the work that I do with very senior people. I believe that whether it's a person with low experience or person who's close to my age and heading corporations, people are facing similar dilemmas. And whilst they may be extremely good at the job that they do, proficient technically, etc., but when it comes to managing the mind, managing themselves, managing their emotions, people break apart very soon. They're not able to handle these challenges. So I think that going forward, we've got to be able to, work with the individual at the individual level, with people who are perceptive and using tools that bring out individual traits of a person. So you are in the business of creating psychometric frameworks, tests,
Assessment,
etc.
yes.
I believe that these tests have to become far more personalized. So if you do a test on me, they must tell me aspects about me, and when the report actually comes into me that these are the aspects that I need to tailor, this report will be a unique report tailored to Daljit Singh and will not necessarily ever be produced for somebody else, when that test is carried out. Because if it doesn't serve the individual purpose, then we are moving away into generalities, and generalities don't solve individual problems, is what I generally believe. So whether we are able to achieve this fine level of attunement or not, I don't know, but directionally that's where we need to go. Personalized reports, I believe, will enable the individual, will enable our HR fraternity and leaders of the business to tailor interventions that are personalized, to the individual employee. And that's the direction we have to head towards in the world of the future, is the way that I see it. I don't know whether I've
Yep,
answered
yep,
what you asked me.
yep.
Yeah,
Absolutely, and
thank you.
and some. So
Okay,
viewers, we are
thank you.
getting. Alan, you want to add something to that? Go ahead.
Totally agree. It's a data world for sure. And the important part of what I think what Daljit said is, while information is power, actionable information and actionable data is empowerment. And that's what we really need. We need to take that, everybody talks about these data repositories. Unless you can, forget about monetizing them, unless you can use them effectively to self-betterment or overall betterment, it doesn't matter. So that fits form and function with what Daljit was saying. I agree.
Great. We're coming towards the end of the program. Paul, go ahead.
No, just to quickly add to what both Daljit and Alan have said, I think one of the big changes that have happened is the recognition that this is reality, that there are concerns which people have at their individual psychological level, and that's not something that makes me stand out. I am part of a fairly large universe that is the reality today. So I think two things that have happened through COVID. One is the recognition that while people may be great performers of their tasks, they're also humans and carry with them their fragilities. And some of those will come to the fore and we need to accept. So there is recognition and acceptance of well-being related challenges and issues. And I think that's a great thing, because especially in India, where we are so reluctant to acknowledge any kind of apparent quote-unquote frailty that will A, make me look bad, and B, make me more insecure vis-a-vis my work security.
There's an entire stigma, right? The stigma, social stigma that's attached
So I think that's been a wonderful outcome of COVID. The fact that this is a situation that is not for the very few. It impacts a very large
proportion of the populace.
And that as organizations, you can't, other that bunch. You have to be inclusive and empathize and make them part of the process. And only then will you, make that break between an organization that, like Daljit said, truly takes care of its key resource, which is its people.
And also tying it back to what Daljit said right at the beginning of the program, this is not something that is COVID dependent. The COVID has triggered this, but it's not going to be that each of us has got a shot in the arm, and by Christmas 2021, all of this goes out, right? So to that extent, Paul, we were discussing this earlier, that I think the Hinduja Foundation is coming up with this entire facility, right? The Center of Excellence dedicated to mental health, right? And well-being. So it's something that's going to be there permanently.
Yeah,
right?
and absolutely. I think, in our country especially, even though we are very, very, family oriented,
conventionally minded, culturally.
And there is a larger support group and all of that. But there are certain subjects which are taboo, and mental well-being is one of those. And I think one of the great things that has happened with COVID is that a lot of these issues, and it's not just mental well-being, it's also, some of the other things we alluded to in terms of, the reticence to approve things regulatorily, all of those have got brought to the front and center and have got some empathetic addressal. And I think that's really the wonderful thing that has come out of COVID.
Right, indeed. We have time for a couple of questions. So let's get started with Ishani's question first. Although this is addressed to Daljit, Paul, because of your association with in the group, you might want to chip in as well. But Daljit, first of all, saying, how can the private healthcare system provide better and more affordable services to the public now that the perception about the public sphere is also changing?
I believe, Ishani, thank you very much for your question. And it's important for us to understand that what is affordable, what is an affordable price line and for what level of quality. Unfortunately, I've worked in the corporate sector earlier on, as well as now last 22 decades almost in the healthcare sector. The investment that goes into healthcare, whether it's medical technology, doctors, training, staff, quality protocols, it's a huge investment that actually goes in. So the prices that we actually see in India, whereas they appear high to maybe the common man or people who are not necessarily very well off or insured, they still happen to be the lowest costs compared to any other cost in the world. And it's interesting. For example, a cardiac bypass in our country can cost you less than rupees 2 lakhs, whereas in a country like America, it can cost you 50 times more than that. It costs about 1 crore rupees in USA. So I think what we need to understand is that in healthcare too, there are different levels of quality and provision of services, and we need to be able to acknowledge that. That doesn't mean that we shouldn't look at means, ways of reducing costs and providing better quality. That is an ongoing effort by every hospital organization. That's what they spend most of their time on. I know hospital organizations in the country during the pandemic time who have had to, reduce costs by about 20-25% overall. And this has been driven largely by the fact that because of COVID, the occupancies of hospitals dropped. Elective patients almost stopped coming to hospitals. Even now, there's very low trickle of elective patients. So if you want a knee surgery, you say, I don't want my knee surgery. It'll, let it take place after 1 year and you'll see it. People are doing teleconsultations, staying at home, and they're not necessarily coming to hospitals. And under that situation today, we are having to cut down costs in most of the hospitals nationally. And so it's a big issue today in hospitals, that hospitals are not necessarily very profitable organizations, unfortunately. But this endeavor is on all the time.
Right. Paul, do you want to chip in here? Well,
I think I agree with Daljit entirely. Having said that, I also pick on one of the things that he's saying. When you talked about teleconsultation and things like that, I think at the at the high end tertiary hospital care, you are in that situation where hospitals are struggling with COVID related impact. But I think that's a question of time. It'll sort itself out. But what has come out of it is the great thing about the widespread access possibility when it is underpinned by technology. So today, for example, that ability to clamp technology onto access has made things, at least at the, for example, when we do primary healthcare in Eastern UP, it's a doctor who goes in one of our mobile medical units and ends up setting a little bench in a village. But today with the technology, what is happening is that a doctor creates the first level of interaction and promptly can actually access a pool which sits somewhere farther off and has much higher level of competence. And the ability to get that level of attention, which was never the case before, has been enhanced because technology has not only provided the access, it's also provided that access at a much lower cost. So yes, I think that's one of the great fallouts of this. And to answer Ishani's question, I think the moment you start to, combine technology with access, you're going to have a much better affordability.
We're going to have one more question, Shonok's question, coming up after this. And maybe, okay, so I'll just read that out. How have employees responded to the innovations that have been brought in by companies in dealing with mental health? And has it also enhanced productivity and conviction? So let me contextualize this. I think across the board, companies both large and small have institutionalized, have actually taken advantage of the disruption of the pandemic to institutionalize EAPs, right? Or employee assistance programs. And many of these have also involved helplines for psychological counseling and so forth. So I just want to put that context out there, right? So broadly, how has this impacted or benefited employees, do you think? And that's open to any of you, gentlemen. Alan? Yeah.
Paul's point earlier, talking about the people who are reticent about coming forward, that are fearful of repercussions, that's certainly probably improved. I think anything that the companies are doing, or even if just one person more took advantage of an EAP, then it's a victory. I think it's one of those things that you sit there and say, what a great benefit to have, that people don't take as much advantage of as they should have, as they should. So I see that with the companies I deal with on a daily basis, when I read through offer letters, when I read through company benefits programs.
Right.
I think it's one of those things that's part of the picture, and is there, and it's it's not necessarily utilized as much as it should be.
Right. I mean, these kind of things tend to be in the fine print, and they've never been front and center, but now I think they are going to be increasingly. Daljit?
So I tend to agree with what Alan is saying, though I think in the US they are far ahead than in India. I think mental health is still very much in the closet. People are diffident of acknowledging that there is an issue of whether it's depression, inability to cope with pressure, stress, etc., and to seek help. Having said that, I think there's growing recognition that it's better to seek help early rather than allow the problem to fester. But we don't see too much of this happening. Having said that, I believe that the next at least 5 to 7 years, we should be seeing a lot of action in this entire domain. I think as more and more people are willing to come out and demonstrate their vulnerability and say that, look, I've got a problem and I want a solution, it will have a cascade effect on the rest of the population, because by 2030, according to the World Economic Forum, mental health is going to become the most prevalent non-communicable disease in the world. It will overtake cardiac and cancer and everything else. So the sooner people get onto it, the better it is. And we've got to, remove the taboo associated with mental health. Doesn't mean that you're mad, that you're off. It simply means that, like in any other thing, that there are certain aspects of you that need strengthening. So, but it's very, very incipient, I think, in India. Very low traction at the moment.
Right.
May I?
Yeah, please go ahead.
It has to start at the top. It has to start at the C-level of these organizations, and the challenge there is the person that's leading the show, he or she is the pillar of strength and the pillar of positivity and the pillar of, this commonness of goal about what we're going to accomplish as a company and the strength of the company. The words that are used throughout his or her addresses are the complete opposite of what mental health represents.
Exactly.
And therefore, you've got this this juxtaposition that's really hard to bridge. So I think we all agree on that.
Yeah.
Exactly. Paul, final words before we wrap up.
Yeah, I think employees are dealing with the positives and the negatives. The ability to not necessarily be bound by the routine of getting up every morning and going to work and coming back and being away from family, etc. I know a lot of people, and I heard Daljit say so also, find that hanging around in Mumbai is not necessary to be productive. You can go off back home wherever. I know I have cousins who have relocated to places from Mumbai to places like Bangalore. They found that they could bring up their child better, they live in better housing, all of that. So there have been many beneficial fallouts of this. The current phase that we are in is the phase, I think, where we will have to deal with the final reality of how to best manage the balance. Because now things are almost normal again, at least in most workplaces. Also have a sense of what were the issues during this period, what the positives and the negatives of work from home, what were the positives and negatives of not having that interaction and that mutual support system. Like in the old days, if I didn't know something, I walked down the aisle and asked somebody for help. Today, when you are at home, that's a more difficult conversation to reach out to people to ask for help. So some of those things, need to be worked through. But I think at the end of it, not too far from now, we'll get a much more positive, empathetic, humane working environment overall, is my belief.
Great. Amen to that. And on that promising, hopeful, encouraging note, we're going to draw this conversation to a close. It's been, we've gone way over time, but it didn't feel like it, at least to me. This has been a very, very engrossing conversation. So thank you all very much. And I'm sure the viewers have also got a lot of very important insights and takeaways for them. For the viewers, our next episode in this series is on the 26th. So you might want to block your calendars. That's Friday evening, 8 p.m. India time. And we are going to bring together for you 2 or perhaps 3 of the biggest names in the business when it comes to mental health practitioners. So we will have a professional psychologist and a psychiatrist to answer your questions next time round. Until then, thank you and stay safe.